Hi, I'm performing an incentive spirometry. So every time we perform this one, make sure we inspect the device for any cracks. If there is any cracks, make sure we should replace it with a new one. And then prior to going inside the patient's room, we have to check the patient's chart, obtain any information, or we should obtain the physician's order that if they really ordered to have an incentive spirometry to the patient. So once inside, we introduce ourselves to the patient, and then after we introduce ourselves, we should check the ID band to ensure they're the correct one, correct patient. And then we always make sure we do our vital signs and then include it with a pre-auscultation, which is important to this therapy. And then if the patient can sit upright, that would be better. And then if the patient can no longer perform do a sitting upright position, we can just reposition the head so that we can perform the therapy in the exact and correct way. So after that, we wash our hands and then we will proceed in explaining to the patient. So assuming if I am the patient, so first is I'm going to set the device, and then make sure we also have this chart, especially taking up the ideal pressure that's gonna be set up to this device, especially for male. So we should obtain it via its age and its height. So mine is about 2000. So every time we do this therapy, it is much recommended that we should demonstrate in front of the patient so that they will be able to fully understand. So it's already being set up. So first is we have to let the patient exhale all the air out away from should be not inside the device until we feel our lungs are empty. After that, should be inside our mouth. So when putting this one inside the mouth, we should take a tight seal, and then we should take a slow deep inspiration until we notice the piston to rise until this one. And then when the piston rises, it means that it was able to help the air sacs in the lungs open. So after we take a slow deep inspiration, we hold our breath for about 3 to 5 seconds until we notice the white piston to drop back to here to 0, and then remove our mouth from the mouthpiece and exhale normally. So assuming I'm the patient, so first is I'm going to exhale all the air out. If I can perform another one, we can also let the patient rest for a few seconds, and then we can do another one. Then so ideally it should be done about 10 times, and then when performing this, it should be waking hours or every hour. And then every time we do this, we make sure that we let the patient cough after doing this therapy. And then when setting this one, we should put it back to the safety bag, and then the mouthpiece should be covered with a clean tissue cloth, and then put it in here. And then we should always make sure that we keep on coming back every hour so that the patient can understand and able to practice it, so that it will fully expand their lungs and open and prevent any collapse. And then if the patient, assuming if I'm the patient who just came from surgery, so when performing that, there should be something in front of me such as a pillow, so that it would help and assist, especially if I feel or sense any pain. And then assuming also if I was the patient who just suddenly feel any dizziness while performing the therapy, we should stop the therapy, especially if I just started it like maybe about 1 or 3 times, and then I feel any dizziness. Stop the therapy immediately, and then reassess again the patient, obtain the vital signs, and then document in the chart. So after every procedure, we should let the patient educate that they should perform this or practice it every hour, And then once we're done everything, reposition the patient, obtain the vital signs, let the patient cough every after therapy so that they can remove secretions, and then re-auscultate, and then once we're out, we should wash our hands and then document what our initial